Good morning, students. In today's lecture, we will discuss about the anatomy of the external ear. For the purpose of study, we divide the entire ear into three parts, that is the external, middle and internal. और उन parts के further कुछ components, कुछ structures से वो composed होते हैं. तो one by one we will discuss about all the divisions of the ear and the different parts it is composed of. In this lecture today, we are concerned with the external ear and its parts, and we are mainly concerned with the auricle. So, the external ear consists of two main parts, the auricle, which is also known as the pinna, and the external acoustic meatus, also known as the external auditory meatus or external auditory canal. So in this lecture today, we will be discussing about the auricle, and we would also discuss about a few terminologies that are associated with the auricle, certain anatomical terms that are related to the auricle. We would be discussing about them, and we would try to identify them. So what is auricle? It is that part which is seen on the surface. So this is the auricle or the pinna, which is visible, which is seen on the surface. So we divide this auricle into a greater part and a lowest smaller part, which is also known as lobule. जो greater part है, it is composed of elastic cartilage. और वो इलास्टिक कार्टिलेज जो है उसकी अपीयरेंस है एज अ क्रम्पल्ड प्लेट. क्रम्पल्ड बेसिकली जैसे किसी पेपर को हम क्रश कर देते हैं और उस पर क्रीज आ जाती है, सो दैट इज़ क्रम्पल्ड. इलास्टिक कार्टिलेज को ऐसा लगता है जैसे एकदम क्रश कर दिया है. दैट इज़ द काइंड ऑफ अपीयरेंस ऑफ द ग्रेटर पार्ट. दोनों तरफ स्किन से लाइन है और ये वो पार्ट है जो हमारे स्पेक्टिकल्स को सपोर्ट देता है. Lowest part, also known as lobule, is a very soft part composed of fibrofatty tissue. Skin से covered है ये भी, and it is the portion जहाँ पे earrings पहनी जाती है. So in this is a human ear, and this is auricle, which is part of the external ear. And in this, we can see this is the greater part. This is the elastic cartilage, crumpled. And this soft part made of fibrofatty tissue is the lobule. So this is the smaller, lowest lobule, and this is the greater part. Now here in this, with the help of this figure, we will study the different terminologies, anatomical terminology associated with the auricle. तो auricle में basically आपको कुछ elevations दिखते हैं, कुछ ridges दिखती हैं, and कुछ depressions दिखते हैं. तो one by one we'll name all those, we'll try to identify all those parts. तो यहाँ पे सबसे पहले ये जो raised ridge है, this is the helix. इसको कहा जाता है anatomy में helix. और इस helix के just opposite side में this is the anti-helix. जस्ट इससे ऑपोजिट साइड, इससे सामने की साइड पे जो स्ट्रक्चर है दैट इज द एंटी हेलिक्स. सिमिलरली आपको एक रेज्ड रिज यहाँ दिखती है. दिस इज द ट्रेगस. दिस पोर्शन इज द ट्रेगस, एंड जस्ट इसके ऑपोजिट साइड पे आपको जो दिखता है दैट इज द एंटी ट्रेगस. दिस इज द एंटी ट्रेगस. टॉकिंग अबाउट द डिप्रेशंस, एक यहाँ पे आपको दिखता है दिस इज द ट्रायंगुलर फोसा, फोसा ट्रायंगुलरिस. दिस हेयर इज द फोसा ट्रायंगुलरिस. एंड सिमिलरली there is a depression, large depression here and a depression here. This is known as the concha. This is known as the concha. So these are some of the important parts of the auricle. Now the nerve supply. So nerve supply को study किया जाता है, एंड पूरे ऑरिकल को डिवाइड किया जाता है इनटू अपर 2/3, लोअर 1/3 एंड रूट। और दो सरफेसेस में डिवाइड किया जाता है, मीडियल सरफेस एंड लेटरल सरफेस। जो सरफेस आगे की तरफ है, एंटीरियर साइड पे है, दैट इज द लेटरल सरफेस, एंड on the posterior side is the medial surface. So in this, basically for the purpose of nerve supply, the ear is divided as the upper 2/3, the lower 1/3 and the root. ये जो part ear का attached रहता है, this attached part is the root of the ear, and this is the lateral surface, and on the back side, on the posterior side जो surface है, that is the medial surface. So upper 2/3 में medial surface is supplied by the lesser occipital nerve, which is a cutaneous branch of the cervical plexus, and the lateral surface, that is the anterior surface, is supplied by the auriculotemporal nerve, which is branch of the trigeminal nerve. Lower 1/3 on the medial and the lateral surface is supplied by the great auricular nerve, which is also branch of the cervical plexus, and the root attached portion of the ear is supplied by the auricular branch of the vagus. In this figure here, you can see the different nerves. So this here is the lateral surface. This entire anterior surface is the lateral surface. This is the attached portion is the root, and you can see the auricular branch of the vagus supplying this portion, the root portion. Upper 2/3 of the lateral surface is supplied by the auriculotemporal, and lower portion, lower 1/3, is supplied by the greater auricular. This is the medial surface, and this is supplied by the lesser occipital, and the lower portion is supplied by the greater auricular nerve. The arterial supply is by the external carotid artery, the branches of the external carotid artery, that is the posterior auricular and the superficial temporal. Lymphatic drainage is by pre-auricular lymph nodes and post-auricular lymph nodes. Nerve supply may be, arterial supply may be, as well as lymphatic drainage may be. There is again and again repetition of the word auricle. So it's easier to memorize because जो vessels जहाँ जिस surface पे आती हैं, they take their name from the same place. In this figure, you can see this is the external carotid artery, and it is giving away the superficial temporal branch and the posterior auricular, because ये auricle से पीछे वाले side पे posterior auricular and superficial temporal, both of them would supply the auricle. In this figure, you can see various group of lymph nodes. Mainly we are concerned with the pre-auricular, that is this here, and the post-auricular, behind the ear, behind the auricle and in front of the auricle. As far as clinical significance of the auricle is concerned, the cartilage or the cartilage from the concha or the cartilage from the tragus or the fat from the lobule is often utilized for as grafting material. They are used for reconstructive surgeries of the middle ear or the bridge of the nose or the ala of the nose. So these cartilages can be used as graft material for reconstructive surgery. That is one of the clinical importance of the auricle. So that's it for now. In the next lecture, we would be discussing about another part of the external ear, that is the external acoustic meatus. Thank you so much.